You're watching Channels Television. It's time to switch gears and talk about health and healthy living as we bring you up to speed with what's going on the local and international health arena. Of course, the platform is Health News. Welcome to the program. I am Yomi Otaigbe. The storm in Nigeria's health sector is yet to settle as a strike by the joint health sector unions, made up of other healthcare workers except the doctors, continues in federal government-owned hospitals, with the possibility of a solidarity strike by their counterparts in state hospitals. Since the JOSU strike began on November 13, there have been meetings between the union and the federal government team. But so far, the issues, especially the salary adjustment demand, have not been resolved. Another meeting has been fixed for December 15, 2014. But in the meantime, patients and their family members remain at the receiving end. Many people have wondered why irreplaceable lives have to be lost before both parties resolve their issues.
During strike actions, nobody is spared of ill health. It could be any of us. Consequently, I appeal to striking unions and indeed all health workers to put the interests of the patient above all interests. If I tell you that their absence has not affected operations in the system negatively, I am not being sincere to myself. I think their contribution is very important, and that is why we feel that both the government and the union themselves must come to a dialogue and ensure that the system returns to normalcy.
While Nigerians in need of medical services wait impatiently for the end of this present strike, which in itself encourages medical tourism, Nigerian medical experts from America, under the umbrella of the Nigerian American Medical Foundation International, NAMFI, at its second annual meeting in Lagos, X-rayed medical tourism in Nigeria, the challenges and opportunities. The meeting paraded a roll call of dignitaries such as Nigeria's former military head of state, General Yakubu Gowon, Dr. Christopher Kolade, Ambassador Arthur Mbanefo, and former ministers of health, Julius Adeluyi and Professor Adenike Grain, among other veteran health practitioners. The high point of the event was a keynote address by General Gowon on the state of healthcare in Nigeria.
It is tempting to say so much about the decay in the nation's health institutions that in the 1980s were described as mere consulting clinics. It is also tempting to examine ways by which successive governments have tried their utmost to arrest the situation, not just on their own, but with the active participation of the private sector.
This subject matter is one of the critical concerns to be addressed by the Committee on Nigeria's Centenary Celebrations, not just because of the need to stem the outflow of foreign exchange, but for the national pride of maintaining medical excellence in our country. I say this because oftentimes people miss the important point that excellence in the medical sciences is predicated more on the human element of medicine than on the quality of available equipment.
Other speakers also comment on the need for improved healthcare delivery system.
I know of states where governors have started something fantastic for health or for education. As soon as they are replaced, the next governors come in, say stop that.
Do you know what has happened in this country? The doctor and his employer have a disagreement. In fact, if the doctors are to be believed, they make agreements with their employer, and the does not keep the agreement. So what happens?
Right.
The doctor says, because I don't like what my employer is doing to me, forget the patients. Forget the oath that I swore. I am going to punish this employer by withdrawing my services.
If as a surgeon you want to do some operation on someone and the light suddenly goes out, or your generator on which you rely also develops some, and you're in the middle of the operation, it challenges your professional competence. Something has to be done. NAMFI has told you that they want to network with a pool of high-level professionals in America and Canada to promote, to collate, and to make sure that their input into the Nigerian health system adds value. What also really would impress those of us on the advisory board is the fact they're not just saying we are coming from America to do you good. No, they have also contacted very senior medical practitioners and other health workers in this country, professors emeriti, retired or semi-retired, to be able to be part of this as in-country experts.
And in order to encourage diligence and motivate healthcare practitioners, members of the NAMFI board presented a posthumous award to the late medical doctor who died alongside others in the struggle to contain the Ebola virus disease in Nigeria. And that's Dr. Stella Adadevo. The award was received by her son, Bankole Cardoso. It's now time for the formal presentation of the NAMFI mission by members of the board. The mission includes promoting medical care projects that will improve the quality of health care in developing countries.
Let's hold this up in the name of all that is good, in the hope that NAMFI would consolidate with the fullness of time.
Still in efforts at strengthening the healthcare sector, this time support in the area of making provision for Ebola virus disease prevention is coming from the Association of Nigerian Physicians in the Americas, represented by its president, Dr. Nkem Chukwumerije. AMPA donated personal protective equipment for distribution in Nigeria through the First Consultant Medical Center, Lagos.
As members of the Association of Nigerian Physicians in the Americas, felt that we should come, number one, to thank you for the good, excellent work that was done here. It's because of the quality of this institution, the quality of care that is delivered here, that made you sensitive enough to make such a diagnosis, that saved the rest of the country from what would have been an epidemic, really. So we wanted to come and thank you, the institution, and use the opportunity to also actually extend our thanks to the entire healthcare organization, including the Lagos state government, for a phenomenal work that was done by the public response system to assist in the controlling the spread of this epidemic. In terms of volume, what we have shipped is PPEs that are worth about $60,000 as our pilot.
The Chief Medical Director of the hospital, Dr. Benjamin Ohieri, recognizes the importance of the PPEs and promised to make sure they get to the right facilities, including public and private hospitals.
We do not pray for another Ebola or any viral disease in this country, but we believe that we need to be prepared for any eventuality tomorrow. And it is in that context that they have sent to us, to the nation, for us to distribute nationwide some of the products that you have over there, the PPEs, the symbolic elements that will be used by first responders, the doctors, the nurses, and so on.
I represent the Guild of Medical Directors, and I can tell you that statistically, 60% of patients that visit the hospitals, they come to private hospitals first. So it's important that we also participate in the preventative measures in Ebola outbreak. First Consultant did very well, unfortunately, at the expense of some of our medical colleagues, unfortunately. So we have to thank them. And I'm sure one way or the other, we would make sure that we put the names of some of these people who have sacrificed their lives for the country. We put their names somewhere that we will not or never forget them.
The representative from the Lagos State Ministry of Health, who is the state epidemiologist, Dr. Ismail Abdul Salam, used the event to highlight various activities in place to make sure that the deadly virus does not find its way into the country.
In terms of surveillance, though Nigeria has been declared Ebola-free by WHO, but we are still, the Emergency Operations Center is still on. We meet on Mondays and Thursdays. The epidemiology and the surveillance unit are highly active throughout the local government in Lagos State. The health workers at the level of the local government, the focal person in the ward, they have been trained on Ebola recognition and the next line of communications, as well as we still have the social mobilization, the communication team, and the Ebola alert. They are still at alert, and they are giving information to the public in terms of the different ways of communication. We know that during the EBD response, part of what helps us is using the social media. We have using the Facebook, the Twitter, the webs, all are being used, and then we have powerful Ebola helpline, where we have doctors and other health workers receiving questions from the public, giving correct information on the media. These are all ongoing. And then most importantly, at the point of entry at the international airport, even at the domestic airport as well, the ground crossings or the land borders, and the seaports, we are still doing surveillance.